Size matters. Don't just take my word for it. Check out Poiseuille's law. Poiseuille was a French physicist who studied fluid dynamics, particularly fluid flowing through a lumen. And that's the kind of size I was talking about. What did you think I meant? Anytime we're talking about something flowing through a tube, whether it's IV fluids or blood products through an IV, or maybe air flowing through an endotracheal tube, or maybe a patient trying to ventilate themselves through their bronchioles, the size of the tube matters because look again at Poiseuille's law. Look at which element has an exponential factor of 4. The radius, the size across the middle of the tube that we're trying to pass through fluids or air, is what has the greatest effect on our flow or the resistance to flow. So take these two straws, for example. If I put them both here in my Diet Coke, if I suck through this little bitty Taco Bell straw, I don't get very much Diet Coke. Whereas when I reach for my big fat McDonald's straw, oh my gosh, that was really fizzy. Excuse me, I get a lot more soda coming through this big fat straw. So keep that in mind when you're taking care of your patients. If they have bronchoconstriction, of course we're gonna have resistance to trying to ventilate that patient. If you're reaching for an endotracheal tube, grab the biggest one that you can safely pass through a patient. Now look, I'm not advocating for use a 9.0 tube on an 11-year-old kid, right? We wanna keep it size appropriate, but don't be shy and try to intubate a patient with, say, a 6.5 tube. An adult needs a 7.5 or an 8.0 so that we can appropriately move the volumes that we need through that endotracheal tube. And if you're going to have to fluid resuscitate or transfuse a patient, make sure you're putting in a 16 or an 18 instead of a 22. But you also got to remember common sense. A 22 in the arm is better than a blown 18 in the AC. So just remember Poiseuille's law and common sense anytime you're intubating or putting an IV in your patient.